So Nydja is going to talk about maternal mortality, giving a couple of case studies on Chad and Yemen. Thank you.
Okay. From overdoses to mothers dying in childbirth. It is 2015, which means we have hit the mark for Millennium Development Goals, number 5, which is maternal mortality. Within here, I'll be looking at some things we've discussed in class about the right to life, right to reproduce, and the right to do that safely, and not have your rights inhibited in such a way that none of these things are possible. Just we have a operational definition here: the death of a woman during pregnancy or within 1 year of the end of pregnancy from pregnancy complications, a chain of events initiated by pregnancy, or the aggravation of an unrelated condition like physiological effects of pregnancy. The 3 causes of, or most prevalent causes of maternal mortality are preeclampsia, hemorrhaging, and obstructive birth. So this is across the board in developed and undeveloped countries, so it doesn't discriminate in that way. So here, universal cause for concern. Again, those are the 3 top reasons why mothers die giving birth. And again, that's developed countries or undeveloped countries. With the Millennium Development Goals, it's not just countries who are still getting their stuff together that need to make improvements. It's everybody across the board. And these are issues that impact every country. Everybody still has women dying after childbirth. I think Estonia has the lowest rate with 6 cases per 100,000 people, but even they are pushing to decrease that number. So the issues at hand, though, with dealing with maternal mortality would be poor infrastructure, traditional practices, lack of prenatal care, poverty, female genital cutting, presence of a trained assistant, and the level of training for that assistant. It's been shown that a woman is more likely to survive if she has a trained midwife opposed to an untrained midwife, more likely to survive with a midwife than with nobody there at all to help her. And that goes all the way up to someone's more likely to survive if complications arise if they have a doctor. Restricted access to health care, restricted access to government, and self-empowerment. Going back to a couple of these things, I said previously that these are issues everywhere, in every country, even talking about female genital cutting. There are complications that can result in a mother's death from having this procedure done as a child. These things are not just happening in the Middle East and in Africa, and in some cases in South America. There are people who are here, immigrants, descendants of immigrants, who are practicing these traditions. So this complication can happen right here in the U.S. as well as elsewhere. As far as restricted access to government and self-empowerment, that's talking about these countries where women are just not able to advocate for themselves in such a way where they can choose to go out and, 1, get a job and thus attain health insurance, or even be able to influence the political arena, partake in it, so that there are laws to protect them. So we'll get into that in just a little bit. And these, all the pictures I have in here are related to, these are some women from Yemen, and the other pictures I have are of women from Chad. So that's what I have in here. A telling divide. I put this on here just to show across the globe how things are going. And these numbers, I figured we wouldn't be able to see these ones down here, so I typed it up again. These numbers are from 2005, and they're per 100,000 people. So you were correct when you were talking about Nepal having made strides, because even just 10 years ago, they were here in red. So that means that per 100,000 cases is 300 to 549 women dying. So that number has decreased to 170 now. So great strides have been made, and that's just within, again, just within the last 10 years. Unfortunately, there are a lot of people who have not been able to make those improvements. So just to show where women are dying and how that's kind of spread out there. Well, you know, it's not really too spread out. The majority of women who die in childbirth or soon after due to complications are in Asia and Africa. So. And to make it personal, because I like to do that sort of thing, I had a guess of who would be here in class, and from what different areas, and the people who I focused on again. So I have Chad and Yemen as the focus of my study. And Chad, I think, is, you know, they compete, if you will, maybe that's vulgar, with Chad, Afghanistan, and South Sudan for the highest number of maternal mortality deaths. I think, you know, even 1,100 to 100,000, it's still kind of a funny number. That's about, in Yemen, I think it's 1 in 8 girls, depending on the actual age of the girl. And in Chad, I think it's 1 in 11. So that's a lot of deaths. So we have Bangladesh, and 240 deaths per 100,000, Nepal 170 per 100,000, Saudi Arabia. In the beginning I was looking more at the general, you know, Middle East area, but I realized that, you know, Yemen is really the only country that's kind of falling behind, because as you can see, Saudi Arabia is, you know, three behind us. We're at 21 and they're at 24. And that seems to hold true for most of the countries in that area. And then we have India on the bottom. The numbers I have here, when we talk about Millennium Development Goals, these are where they want the number we have here. This is where they actually want these numbers. So we have a long way to go, considering the fact that some people's, like, over here, Yemen and Chad are just trying to get down to the numbers other countries are already operating at. So we consider those deaths here in the States unacceptable, but they're just trying to get down to that number. So focusing on Yemen, the main issue here is the underage marriage. The female's body has not yet matured, and they are having a lot of kids, usually 7 per marriage. But the number that I wasn't able to find, I was able to find it for some other countries. We're talking about women who are having 9 children. And here, you know, my mom's from a family of 9, but there are 7 living, and, you know, those are 2 underage twins that died. I'm not saying it's a nice thing, but no big surprise. These women are having 9 children, they're only having 2 or 3 survive. Say 48% of the women married are married before the age of 18. And then the poorest 20% of the population, 50% of those married are before the age of 18. And then 14% of married are married before they turn 15. And again, it focuses on this fertility. I think I was chatting with Andrea last weekend about the fact that people want to have these children, but they're not actually doing anything to take care of the women to ensure that these children survive. A large determinant of whether a child will survive and thrive is if their mother actually lives, and it's more chance that they'll be orphaned and die within the first 2 years of life if their mother dies from maternal mortality. The other thing at issue here is that 80% of births in Yemen continue to be performed at home, and with only 1 doctor per 10,000 people, you can see where that may be an issue. You have these girls who have bodies that are not ready to have babies. A lot of times they're sick, malnourished, or they've had issues with previous births that have left complications. And so, again, they're at home, they have no doctor, and they end up dying. This is a young girl, or she's a woman, I guess. I believe she's 21, and those are her children. They are her poor kids. And her husband. And her husband. So, the women in Yemen have absolutely no access to government or voting or advocating for themselves. So their husbands decide if they use these for family planning. Their husbands decide whether or not they'll let women come in as midwives and help their wives. Somebody else coming in from outside of the home, though, that challenges his power and his authority. And so it doesn't happen very often. Were you going to ask? Someone can ask a question? I thought I heard something.
No, I said.
Oh.
Yeah, it's a culture thing.
Yeah. So with, before I mentioned the inability to advocate for oneself, if they want to use family planning, how do they access that? How can they make sure that there's somewhere to go? How can they ask their government, can you provide better services if they have no voice whatsoever? So, and that's not to say that, unfortunately, some of these people do not have the money, they do not have the education. Ignorance is a dangerous place to live, and they just don't know better. They just don't know, and you can't do better until you do know better, unfortunately.
So there's no governmental protection of any kind for someone a woman under 15?
Oh, no. What they're trying to do right now...
Great in America.
Oh, no. There's a big push to try to get the age of marriage back up to 18 because it's dropped down again. And there's just a lot of pushback from that. They want to marry whoever they want to marry at whatever age.
The other experiment is mostly is all male.
And I mean, you have some traditionalists. Again, ignorance is a dangerous place to live because if you want your daughter to have healthy sons, or if she wants to have a daughter and that's fine with you, she has to be healthy and able to do that. She has to be healthy to be able to raise her child. So it would be better in the long run if you waited for her to be an older woman to do these things. The other issue right now is Yemen is on its way to being a failed state. With the lack of infrastructure right now and the toppling of what is currently there, we'll just have to wait and see what's going to happen there. So moving on to Chad, I found this quote yesterday, and I liked it quite a bit. I demand $500,000 to save the lives of thousands of women. And this is Madame Gossinger, Goodwill Ambassador. That amount was denied by the finance minister as too much, asking for too much money. Again, Chad is actually leading the world in maternal mortality. And therein lies, public health issues. If the government won't put anything in place, what do you do then? So only 16% of women have access to care. Poorly trained providers impact all. You have people who have money, and then you have people who don't have money. They have a private as well as a public system, and you will have women who will go in and pay for services and still die from a lack of integrity in the training that healthcare professionals have been provided. The other issue that is here in Chad and not really at all in Yemen is the HIV AIDS transmission as a result of unsterilized equipment. So they can barely afford, as one of the videos I was watching, they can't afford a drip, which is £1.50, or a sterile needle, which may be 25 cents. To us, that sounds like peanuts, but this is quite a large bit of money to them. to the majority of the population at least. And so you have this equipment that's been used and reused, and I'm not talking about some holes. I'm talking about state clinics are reusing equipment. And female genital cutting, that also, again, that presents a challenge as far as HIV/AIDS, because these women aren't going to sterile clinics to have this procedure done. This is something that's done in the home by an elder, using different cutting tools from around the house, which pose a threat for transmission of HIV. Unlike Yemen, there's not a large situation of female genital cutting there, but that is something that is present in Chad. And it presents complications for women giving birth that they end up dying from. This is what is called a harmful traditional practice. Most women will report that they didn't necessarily like it, but that they would continue the tradition. And that in order for their children to actually find a spouse, whether or not they liked it, if they want their daughter to be married, this is something that they have to do. So, again, a harmful traditional practice, and it's not always that these women like it. Sometimes these are decisions that are left up to the men of the family because they believe that if these women are not cut, they're going to be promiscuous, that they'll be unruly, that they will leave the house and wander. I've read many different descriptions of what would happen to your daughter if this didn't. If
I'm
this
just
wasn't
having
done.
such a hard. I mean, I know this is all. Yeah, I know all about it. I just can't even. Where it came from. You don't have women running around raping men. What is that? Anywhere in the world, is there any such,
It was.
It just baffles me.
I believe it was in the 50s. There were women in Israel being attacked, and they set a curfew for the women. And she said, "Well, the women aren't raping men. Set a curfew for the men. If
exactly.
They don't know how to behave."
Make the men.
So,
cut the women. So
yeah,
they'll behave.
It's very strange because a lot of places you'll have compounds, and the women really do have to stay within the compound or work within the compound. So at what point are they actually coming across or in contact with somebody to engage in this illicit affair? Yes, in the back, please.
Not engaging in illicit affairs here. Signing papers.
Oh, no, me.
The cotton and the...
I'm a little bit embarrassed. I mean, I have heard of female genital cutting, but
I don't know
what does that entail?
Yeah, I don't understand what that entails either.
The complete removal of the clitoris, and then depending on where you're from, it'll be like the sewing up of the labia, or just like a pea-sized hole left. Yeah, in some instances they actually cut out the outer lips and sew it and pull and sew it together. Again, leaving just about, I mean, that's how they describe it, about a peanut for a large pea-sized hole for the woman to urinate and menstruate through.
Oh, wow.
So you can imagine how something like that could cause complications during childbirth. So,
wait.
How do you even get there?
Yeah.
Exactly. How do you even get to that point?
Do they like cut that back open, or like, okay?
No. See, what happens, especially in this region, mother-in-laws will actually check the bed sheets to see if she's bled. Because if she hasn't, then she's not a virgin.
Oh.
So.
At what age are they doing that?
It depends. If it's more of a coming to age sort of thing, maybe around 7 or 8. In Chad, though, it's primarily done within the first 8 days of birth.
Oh, like circumcision. Oh my God.
Yeah, and that's what they say. They say, no one complains about a man being circumcised. However, that's I mean, it's not the same thing at all. Men don't.
No, it doesn't affect their hormones for the rest of their life.
Yeah, so,
Wow.
And it's so strange. They've been doing this for a very long time, and despite this, women continue to die. They continue to do this. They know it will cause complications, cause and effect. But again, these are harmful traditional practices, and they're no doctors. There are very few trained midwives there to help these women out. And I'm not saying this is everybody. There are initiatives taking all over Africa to go out and help women, but these places are basically where outcasts live. They've chosen to leave their husband or their father or brother or X, Y, and Z to go and actually help women become trained midwives. So if there's a need somewhere, they can actually go out into the community and help. But again, these women are looked down on. And I guess some women like when they do show up, but for the most part, they are outcasts in our society. And again, this goes back up to the first statement, my last bullet point, just the refusal to allocate more money to address Lacuna and state services. You can't be here unless someone gives birth to you, and there's no effort really on the side of the government to make any actual change in that, and that seems to be the problem in Africa. The Middle East hasn't always had good numbers, but they have actually sat down and implemented different strategies, different changes. They put forth the money. Chad is not, I'm not saying that they are a wealthy country, but throughout Africa there are countries who have more money, and that just goes to larger issues of international relations, which y'all know I love, of corruption and misallocation of funds. And I have, this video that I found is not for Chad, but I thought that the numbers really, it brought the numbers home. Can you look at this? No, it wouldn't let me do it. Well, can I bring it up on here real quick? The numbers in that are for 2014, and they are just for Kenya. And I thought at first they were talking about like Africa, and they're not. So I thought it was really.
You can do it beforehand.
You can just copy and paste
Yeah,
it into
copy and paste in the new
window. Yeah. So this is just for
Kenya.
Kenya?
And she starts talking about the different counties. I was like, oh, she didn't say countries. Yeah, I thought she was going to start saying countries, but it's just for, and this was actually posted last night.
Oh, wow.
Yeah, it was pulled about on the web, on YouTube, and this just came out. This one here?
Yeah.
Thank you, sir.
No, the last one.
She would be brought up under the care of her mother. But as fate would have it, her mother, Lilian Obiero, did not make.
Oh, not that one. Just press the in the middle of the screen. Just double click. Just in the middle of the screen. Just in that. Just like anywhere in here. It's fine. Oh, okay. Sorry.
To breastfeed her for a second time. She died hours after delivery. Heavy bleeding was one of the reasons behind her death. This is despite having given birth in a hospital.
I'm so much disturbed. Reason is the obstacle race. We call it a safe place to give birth.
Now, not even a week old, this little child is part of statistics of the number of children left behind by their mothers who die as a result of pregnancy-related complications. Indeed, maternal mortality in the country has continued to be a major concern as childbearing becomes even more dangerous for thousands of women. According to government records, Mandera County recorded the highest maternal deaths in 2014 at 2,136 deaths, with Wajir County coming second with 581 deaths. The death of Lillian Jr.'s mother at Mama Lucy Hospital perhaps helps to explain why Nairobi County is also in the list of the top 15 counties with the highest number of maternal deaths. Third in the ranking, Nairobi lost 533 mothers last year, despite it being considered a developed county in comparison to other counties. Nakuru County followed at 444 deaths.
So these numbers
Kakamega
just
County
keep
recorded
adding up and
364
adding up
deaths,
and adding up.
Kilifi County 289 maternal deaths. Others in the list of counties with the highest number of maternal deaths include Nandi, Bungoma, Homa Bay, Migori, Kisumu, Siaya, Trans Nzoia, Garissa, and Kwale. Alarmingly, these 15 counties contributed to 98.7% of the total maternal deaths in the country in the year 2014, leading to an intervention by the national government.
We put together the 15 counties which are most affected, or the ones which are most vulnerable in terms of these maternal deaths.
Yeah, it's sad to see it after the fact, but to see some sort of concerted effort
and already there's a very big
put forth opposed to
in terms of making sure that mothers are encouraged to go to hospitals to deliver. That campaign is now very, very effective. And that's why I think as of now the average of mothers going to hospitals have got about 80%.
The 2013 State of the World Population Report.
This just came out last night.
The country is at 360 maternal deaths, 100,000 live births, a reduction in the number of deaths as compared to 488 deaths, according to the 2008-2009 Kenya Demographic Health Survey. Whereas this is a significant reduction, the country's maternal mortality rate still is among the highest in the world.
And the target now, by the time we reach June 2015, the target is to reach 300.
Kenya has continued to persistently have high maternal mortality rates. And with 2015 now here, a year when the world expects that MDG 5 of reducing maternal mortality by 75% would have been achieved, there's little show of it, clearly showing why stakeholders need to up their efforts in meeting the health needs of women and girls. I'm Choge NTV for the Health Assignment.
You broke it.
Again, when I started this out, it was about Africa and the Middle East. This is Dubai, and that is Doha, Qatar. The majority of maternal deaths in these countries are actually from immigrants who've come in for work, not actually the people who live here. I thought I was going to go in and find all this information, but they are doing their own studies of their own populations, of the difference between ethnicities in their own countries. And like, oh, I'm researching other countries who have people from the outside looking up information, but they have the infrastructure to complete their own studies, to analyze the data, and to make changes. So I didn't find what I thought I'd find, but not a problem. I don't mind mothers living. I'm not going to complain. 5 public policy considerations that I kind of came up being the greatest importance, I guess, is the educating of young women about Planned Parenthood, about sex. These women, some of these women are getting married at age 8, so there has to be an initiative in place that actually says we're going to go out into these communities and educate these women, because it's not happening with the parents. And if there's going to be a change, it has to happen. They've already been unwilling, by and large, to do this. So there has to be another type of movement where it again is in these communities. I'm educating these women. I don't have the answers. I'm not saying that would be CC's feat, but educating providers. This goes back to the fact that there are healthcare providers who do not have the skills, the training, and they're not current on new technology. Having something is better than having nothing. But I think that's not too much to ask, is to put time and effort into bringing them into 2015. Building and maintaining sound policy and infrastructure. What I found most alarming in researching this, because I don't know a lot about maternal mortality. We brought it up in discussion a couple weeks ago in class, and I said I wanted to know more. What has been alarming to me is the systems of care, or the lack of those. I mean, everything is infrastructure. If there's nothing set up to address these concerns, these women just fall through the cracks. There's not even a way to, with any type of integrity, to research and document cases of maternal mortality. We have some of these numbers, but we think people who've been doing the research believe that they're not actually being reported on properly. Because if you go out to these places in Chad where women are having babies at home, or in Yemen, people are having 80% of their children at home, and these women are dying, what report? Who do you give this report to? So how do we know that these numbers are even correct to actually implement change? How can we do that if we can't even do the research on it? So, like I said, the need to actually build and maintain sound policy and infrastructure. The involvement of the government. The government is what sets the legal, age for marrying, but they refuse to leave it at 18. It keeps going down, it goes back up, it goes down, it goes back up. And you have these young brides who end up being victims because of it. Cognizant of shifting trends. Yemen is currently in a type of civil war type situation. I think it's good to be knowledgeable of that and how that will impact the women there. The women there are already living pretty restricted lives, but the government that is actually coming into power is Al Qaeda. So for that region, not the same as in Afghanistan, it's their own regional version of that. So how would that impact the women of that country? Like I said, you guys know I love international relations and cultural stuff, but these all play a part. You can't just show up somewhere and start telling people how to live their lives. Not only is that dangerous, but it usually doesn't work. I'm not sure about you, but I don't want people talking to me in any kind of way. So you have to know. You have to know who you're dealing with. And then again, it's implementing words into actions. That's what all this is. Saying you're going to do it, sticking to it. It's 2015. There's so many countries who just are not going to make the Millennium Development Goals, not just maternal mortality, but some of the other ones that have been put forward. But this, unfortunately, is one that I think could have, more improvement could have been made. It just hasn't been.
Have any countries made the Millennium Goals?
Well, as of 2010, there have been a couple people who've gotten close. The U.S., they say, from what I've read, has actually gone up in maternal mortality. But
well, they're at 16.9. I thought they're at 10 or 11.
I'm not. I had it on here, but I'm remember off the top. It's 20. Their goal is to have less than 5 per 100,000 by this year. So this is, but these numbers again are 2010. So this is itself 5 years old.
Yeah, I think the most recent out of the CDC is, I think it's 10. I think it's 10.9, and for Native Americans it's 16.9.
Most regions have decreased their numbers except for Africa. They've been, for the by and large, stagnant. It's almost as though 2015's here and people are like, oh, there are some countries like Ethiopia who are kind of introducing new legislation, but it's like, well, it's 2015 now. So anything's possible in the future. Right? And then just walking away, for women in Africa and Asia, there needs to be motivation on the part of men to keep their daughters alive, to keep their wives alive, to keep their sisters alive, to keep their mothers alive, because they are in a position of power. So nothing, you know, even the civil rights movement, Johnson had to sign that into place before it actually happened. Somebody in power has to make the decision to change. That's what we walk away with. And again, just improvement in infrastructure. Are there any questions?
So the U.S. maternal, it did rise, and it's higher now than Austria, Finland, Iceland. So it is on a rise.
I know.
And they're looking at policies.
We're like 43 in the world.
And they said it, yeah, rose 7 times. And then they also, interesting enough, this is the World Health Organization. Look at it, but some of the stuff. So you're looking at policies, like policies in the U.S. that are driving that, or I guess that's the argument, or that's what I'm saying.
Oh, really? I didn't do too much stateside research, but I have looked at, you know, surveys on where not to have a baby in the U.S. Just because of what is actually covered by healthcare, through people's like employers and what kind of services you can get, and then they actually have. Again, I don't have anything to share really, but I won't be having any babies in the South. Maybe Florida. I mean, that's not really. Well, no. I mean, Florida isn't actually included in that cluster. It's Mississippi, Alabama, Louisiana, Utah.
You're like, no. So how? I mean, it's hard. Like for countries like that. I mean, that's so high, 1,100 per 100,000. How would you even?
It's so many different
try to make some change,
play, because we can talk about comparative foreign policy and what these governments are actually doing. Well, they're fighting a million different kinds of civil war, and there's a coup every couple of
they
years.
Can't within that even have a healthy.
What time do they have to set aside to make sure that women are surviving and all of that? When in fact, when these things are going on, when war within the country or with another state, people who are most vulnerable, as we know, are women. They're the ones who are the most impacted by conflict. So.
And the cutting is in which country again?
It's throughout places in Africa, Northern Africa, the Middle East, and some Asian countries, but not as much as in Africa. And there, I came across a study a couple of days ago of a few in Brazil and Argentina. Wow. Yeah. But that may be a result of
migration
in the slave trade. Oh.
In the UK, excuse me, Leanne, some doctors have been prosecuted for practicing female mutilation, genital mutilation on immigrants from countries where it's a custom. And the UK, I think, medical practice and the legal community has decided it is against UK medical practice and guideline, and doctors will be prosecuted, even if the doctors are from the same cultural group, as it becomes sort of a substantial issue. There are variations of the type of marks that are made, and in a few cases it's just a scratch. In others it's a removal. But in some cases it's like a ritual, just a scratch, like on, you see some people with a scratch on their face. So you have to look at each culture to see exactly what is being done in terms of the extreme.
And it's so varied. I mean, there's so many tribes and arbitrary lines in Africa.
So are they making any other strides aside from trying to provide or promote the women to going to hospitals to have birth? Or are they actually trying to educate them?
It differs. There's, like in Chad, there's not a lot happening on the state level. But you go to places like Kenya, where you actually saw the Minister of Health speaking there. But everybody's going to make change when they're talking to the camera. So who knows if that's something that's going to be followed through on. Some places have doctors who've gone to school in Canada or gone to school here in the U.S. or England, and then they've taken those skills back, and they're on. I've come across midwives on a mission, or I'm going to try and train 1,000 nurses so they can go out and be outposted in these different communities so that they can have access to it. It's not. I haven't come across a lot from the government is doing this now. It seems to be individuals, but
so Somalia has equal to Chad and the Sierra Leone. So those are the top 3 in the world. Is there any like foreign policy or some type of sanction or some type of? I mean, it's a Sierra Leone. It's our diamond. This is where all these different. So I mean, that has to have some type of impact. Or
I'm not sure how many. I mean, you think about diamond trade. It's not.
The lowest is Greece and Estonia.
Yeah, random or not random.
2.
I'm sure they're
they have 3 per 100,000. 2 per 100. It's amazing.
That they're doing that to different.
I just had a question regarding, I guess, the culture of the people there. Whether or not do the men have multiple wives? And are they considered rich and culturally? If they have a big family, are they considered like at a higher status?
Yeah, definitely, yeah. Definitely so. A lot of them obviously can't afford the one that they have. That doesn't seem to stop people in their positions. So, again, women lose out. Because she doesn't have a say in it. And the thing too, if these people in these societies are having daughters, that doesn't do anything for them. They need to send that. They can make money off of getting a daughter ready into marriage.
So they're bought. The women are bought during marriage.
Essentially traded.
Okay.
It is. They are considered. They're considered property. And in a lot of places, their say counts for half. Like literally half of that of a man. If you're going to testify against a man, your testimony is only half of what his word is, so your word automatically doesn't go. By law, literally is half. So,
I'm just kind of curious.
Yeah.
Can I ask you a question? When I looked at female genital mutilation cutting, as I recall, everything I read said that the procedures were done without anesthesia. So why do you think there isn't just world outrage against I mean, that kind of behavior. Do you think that culture trumps barbarism?
Not personally.
I mean, why isn't the world?
By the way, the nerve endings to the clitoral area are immense. It's not like an unsensitive area of the body.
Yeah. The argument that a lot of people would come back with is like, oh, well, you know, that's what poor people do. I have money, and I take my daughter to the hospital to get it done. So it's not everybody. Well, people in the States who have the mutilation, cutting done here in the States, so they'll send their daughters back home to have it done. So usually if it is people within the country, it is without, my understanding. But some people will know it's clean and we have.
Are you telling me that they send them to the States and it's done by a professional?
Yeah, professional medical doctor.
Who does that? Where in the United States? I don't know of any such thing. I don't know of any such thing.
And I think the culture does trump this, right?
What do you mean I'll be in big trouble?
What you just
Because
asked.
if you're found out as a doctor.
Oh, so it's not being done as
Open.
open.
No, not openly.
But that's supposed to be a safer way of doing it, and the people with money do it that way.
I had a conversation. I recently moved here from the DC area, a large population of East Africans, and I worked with a few, and they get up in arms about it. My daughter will have it, my granddaughter will have it, her daughter will have it as well. And they can go to doctors stateside to get it done. And if I can't find something stateside.
So when it's done under those conditions, what's the extent of mutilation? I would think it varies vastly when it's uncontrolled, but if you're even though this is uncontrolled too.
Well, as you said, it differs.
Right, so when it's done that way, who's to say the extent? Because it can be so...
I have no idea. I'll have to... So
what he asked was, why don't we have worldwide upheaval?
Yeah, well, why wouldn't
the out group? I really think it's that simple.
It's a minority.
Let somebody, I have yet to been to Africa because it seems like a very dangerous place. And maybe I'm wrong and I shouldn't feel that way. But I'm going to tell you that if someone is ever kidnapped and that is forcibly done to them, I think it will be on the American radar fast and in a hurry.
I think if it was male in that sense, it would be different. I
What?
think it's female because it's a female, and the way to the extent that females are valued, have a lower value in that sense, right? And that's across, populations historically. It's their children.
Birth at 8, 9 years old.
But there's plenty of, femicide. I mean, females generally, historically, through different populations, have a lower, their lives are valued differently than whether they were male, and that, I think, contributes to, people not caring, right? Child health, maternal health, that's an indicator of community, though, right? So when females are, the object of this, it's also telltale, I think, of that.
I don't think a lot of people know.
Yeah, I had no idea that they did it in the United States, or that was, I didn't even know what female, what it was to begin with, right?
And it's gone through name changes because
but
that's
it's this cultural.
That's making them feel disfigured. We're not gonna.
So it's like normalized. It's cultural. It's changed. They come up with different, reconceptualize it. Circumcision.
One of the Afro-American female supermodels has brought it to.
I think she's from East Africa. Is it a mom?
Or whichever.
Oh, yeah.
I can't remember which one.
Yeah, she's
but has brought it to expose, a lot of it, and brought it to the forefront.
Yes, it is. I think it is. I have their picture.
It's Waris Jerry. Waris.
I was at work the other day, and a lady stated, this girl on my Facebook page is always posting these children. I wish I could do something so I don't have to see it. And I was like, you don't talk to me. I used to, volunteer as a corresponding special advocate for neglected
kids.
That's always on my register. Yeah. But I don't don't even have kids. This lady has 3 kids, but don't talk about that around me. I don't want to hear it. So, unless you're here.
And it's women that reproduce this as well.
I know.
It's women that are, I'm looking at a bunch of stuff because I've never seen this before.
A lot of times
women
men don't know.
Yeah.
Sometimes the men know, and other times in other cultures. I have a Netflix documentary kind of person. It's called Honor Diaries, and it's about the concept of honor and shame and disgrace in Asia and the Middle East. And they talk about genital cutting there as well. But the ladies talks about the fact that she went to the patriarch of the family and said, do you know this is what they're about to do to that baby? And bringing up all these different things. And he was just like, I didn't realize that's all. Because you didn't realize that these, in these cultures, men and women are very separate. So how much do the women really know about the men, and how much do the men know about the women aside from, little talks here and there? Do they know that women don't actually look like that? Do these men have sex education? Do they know that that's not how that a woman's not naturally that way? Think, okay, maybe somebody in an urban city setting, but does a man know about that growing up in a rural area? Is he provided with that exposure? It's a lot, but if you don't, I was talking to Lata in the parking lot the other day. I told her I was always on, I'm always in it, and my parents wish I would be a little less intense. But most people don't want to hear about it, most people don't want to talk about it. That spoils dinner. So I think that's where it comes in, people's lack of interest, lack of making a real change. Any other questions?
Thank you for bringing this to our attention.
Thank you very much, Nydja. Okay, next we're going to Oak Flats. So I'd like to ask Leanne, please. And you're using your own computer?
Yes, I am.
Good.
Maybe can we invite Isai in?
Oh, yeah. Yeah. We need that child.
I know. I saw that. I think I probably said the same thing at that time.
Just loving life there, Nydja Mercer.
Loving life.
We're enjoying this.
They didn't come. They might come tomorrow.
Oh, they'd be enjoying life here. Everywhere.
It's water again.
Yes. Is that some water? It's the reason, that's why we want you to come back next week, midweek. You need to make a walk from Santa Fe to San Carlos.
We're just waiting for lockdown.
I do.
And could you tell us the names and enjoy? How old are they?
Well, this is my daughter Soleil, and she is 4. And this is my son Philippe, and he's 2. This is the young man that gave me a horrific scare in a trip to Scottsdale Health Center, where we found a very good children's and infancy.
My name is Lalitha Murali. Even though I'm originally from India, we are settled in the US now. I am a public school teacher in Milwaukee, and I teach ESL, English as a Second Language, and I am the Gifted and Talented Coordinator for the district. So what I notice every day is parents pushing, starting from first grade, oh, my son is genius, why don't you put him in 3rd grade? Okay, he may be brilliant, but, age-wise, he needs the social skills. No, parents push too much. So what I do have many students, I work with the kindergarten to 8th grade in a middle school. And so I thought, why not I do, what would be the consequences? You don't need to push your kids in order to, because many parents say that, oh, only when I push him, he will become a doctor or engineer or he'll get into Ivy League, which are supposed to be the top colleges of America. But that's not the case, because I do have 2 daughters. My older one just got into direct medical program, and we never pushed my children. What I did give them enrichment. I used to take them to every day after dinner, we will go to Barnes & Nobles or Hastings, so I would just ask my girls to just explore, read books. So they were from childhood, we loved going to, every summer they would go sit in the library and read books that they like. Those are all the things you can do, but instead of just pushing them, making them skip 2 or 3 grade levels, so I want to see, how that affects the children, so you do not need, when I try to tell the parents that you don't need to, but they are not believing, maybe if I do something like that, look at this is my master's thesis, this is what I found out. So that is why this is my topic, are we pressurizing our younger generation too much? What kind of pressure, you might ask, so I just mentioned in addition to putting pressure on their children to excel in school, many parents are expecting they should also exceed in numerous extracurricular activities, from piano, ballet, taekwondo, dance, and music. So, it's not just the education. So they want their children to excel in everything. What's going to happen if you push your children? Although these activities mold the children into a well-rounded individuals on paper, the lasting effects of not allowing kids to just be kids could both hamper certain developmental needs and heighten stress-induced aggression. So these parents, they will stop at nothing to make sure that their children get things that are better and bigger. So if they think that if you tell somebody else that, hey, this is what I did, my daughter got in, immediately they will put their children in that, thinking that their child is also going to get that. So they do the designer shopping, What do you mean by that is, okay, I want my child, okay, this is the resume I saw, maybe Dr. Giannis' resume. Okay, he went to Harvard. Let me see what kind of education he did. Oh, he did MBA. Let me put my children in those things. So that definitely they will get into Harvard. So they look at other people and exactly make a resume of their, for their children and pushing them in that. That is called designer, So you go and shop for your children. So it is not that I'm forcing my son, oh, he's a musician, he has that innate ability to learn music, so let me put him in music. No, he may hate music, but I want him to be a genius in music, so I will put him in those classes. And customized holidays, so you just say that, oh, this is Christmas, and I know the Christmas is our main holiday, but guess what? You have to go to this Harvard. They have a special holiday, educational program, 3-week seminar for you. You go there. When you come back, we will celebrate Christmas. Okay? So that is your, and over-the-top gadgets and toys. So just, oh, if you do that, you're going to get this. iPad and iPod and those things. And although these luxuries are given with the very best intentions, of course, no parent would have a bad intention for their children. And sometimes you cannot help but wonder, how are these kids supposed to be kids? I just went online and I was looking for some articles, and I found too many articles. So this says that this type of parenting leads to a much bigger problem. Oftentimes, the internal burden will cause children to bully others, act out, engage in aggressive behavior, and are shut down. I'm seeing those behaviors in my classroom, but I don't know how I can say it. But in my survey question, maybe I might ask that, oh, are you feeling pressurized? Do you want to vent it out on somebody else? Maybe though, but I'm definitely seeing these behaviors in my classroom, because I work with these top-notch kids, top 10% in each grade, and these kids do behave. So they will cross. So I am in the backside room, so they have to cross the room before that. So that class is for children who are struggling. So there will be a teacher. So when they walk in, the teacher will be, for example, on the board 5 + 2 is 7, something like that. I'm just making this up. And then this kid will say, oh, you don't know even that. That is bullying. Oh, you are stupid. So they just make a comment and then walk inside. So that is, this is a quote I really loved it. Respect the child, wait and see, the new product of nature. Nature loves analogies, but not repetitions. Respect the child, be not too much his parent, trespass not on his solitude, by famous Emerson. And also I read an article in Daily Mirror. It says the topic is generation stress. So it talks about, so they did a research in UK, the kids with depression, so they were treated for mental health problems. So it says that tormented bullies under pressure to fit in and bombarded with school assessments, many students struggle to cope. So these are all the kids, who, from the research study. According to NHS Mental Health Trust, 4,321 children aged 10 or under, they have received treatment for stress, anxiety, or depression in the last 5 years. So the World Health Organization, estimate that by 2030, just in how many more years? 25 years, depression is going to be the biggest health problem in the Western world, and so we are sitting on a ticking time bomb. So these are some people, they have, under the article, so different articles they have expressed, these are all their views. I see an incredible rise in the stress in families, said a principal, and then the high pressure run up to college, claims many victims. There's a consistent urgency that you have to be the best. So that's a high school junior. So what are all the signs? The signs of anxiety from too much pressure to succeed at school. So the kid will not be able to sleep, eating disorder, depression, excessive worrying, cheating, or burnout. Loss of interest in activities previously enjoyed or withdrawing from friends and family, these could occur. But I don't know how I would be able to measure these, but I'm going to say that, do you feel depressed, and do you see children, I'm planning to do a survey with teachers, my students, maybe some high school students, I'm thinking 100 kids, and then 50 teachers and 10 counselors. It would be, but I don't know whether how I would be able to measure these. I can maybe ask questions that sometimes do you feel pressurized or depressed, that is the best I can ask, I think.
Yeah, you got to come up with a good questionnaire.
Correct.
So you do elementary school kids?
From 4th to 8th grade.
4th to 8th?
And then 9 to 12 from high school.
Oh, you also teach 9?
Yes.
So, it would be interesting also to see college. Anyway, just my thought.
Yeah.
But
this will be easy, I can, yeah. This is easy for me. I can talk to my superintendent, get the flyer out, and get it done. And parents also. But college, maybe I can try. Maybe extension, like a science fair. This year this, and next year extension of my summer research. So some of the common physical symptoms are stomach aches, diarrhea, headaches, rashes. That as a teacher I see almost on a daily basis. Oh my God, oh, are we supposed to do this? I think I'm not feeling well today. Let me go to the office. Younger children may experience nightmares or refuse to go to school. Teens may engage in destructive or excessive behaviors, including using drugs or drinking. Other cool thing, I do have, I just mentioned that my older daughter just got into medical school. She went from high school directly to 8-year medical program. My younger daughter is a junior. So as, you know, she would come up and say that so-and-so is going for some test prep. And I said, I'm not spending that much money for you. I have books for you, just go over that. But that is a really big business, you know, so they charge, I think, $100, $200 per hour so that they will train you so that you can get perfect score in the ACT, SAT. Often parents know that the child score before the child does. You know, my husband definitely does that. So he will say that, you got to see it. How do you know? I already saw that in the power school. So it's just, so then the child is automatically, you know, oh my God, I need to do well. My dad or mom is going to see that. School districts and politicians have also joined the race to make American children more competitive. So let me explain. So in America, when President Bush came, it was no child left behind. That means if I have 20 students, 10 students might be really brilliant, okay, or maybe bright, high average, maybe 5 students really brilliant, and then I would have normal 5-6 students. At least 1 or 2 students will be with special needs, you know. So they would, even though they are in 8th grade, they would be at the 3rd grade level. But the government is telling, I have to test every kid with the same test, and everyone should pass, you know. So that is the new rule. And then now in Wisconsin, I don't know about the other states, our Governor Walker, he has come up with, if the schools do not produce that, show the adequate progress, they would not receive the federal funding. And what would a teacher do? What would the school do? You know, if we have students, I think 45% of our student population is from the very, very poor Milwaukee area. You know, many of them are homeless and under foster care. So you cannot blame a school if the children are not doing well, you know. So we don't know what kind of family situations they have. So they have, you know, even they have good intentions. They are looking at comparing Asia and Singapore and Finland, and they say, oh, these kids are performing, why not American kids? So they are coming up with the new laws and new, now there's a Common Core, you know, standards, so every school has to follow. And now, starting from this year, we used to have standardized state-based exam, which is just paper and pencil. Now everything is online, computerized. So a child in 1st grade should know how to plot a graph online. So there is a dot, he has to just drag and put it here, drag and put it there, and click the line, and then it will make a line and make a graph. That even for teachers, it is hard to, you know, manipulate those things online. It's completely online starting from this year. So our superintendent said that, okay, starting from February, middle of February, you guys are giving practice to all these students. So there's no instructional time. We have 1,000 students and we have only limited computers. Each teacher taking the kid to, okay, do this practice test. How do you do? How to click? How to make a thing? You know, we are wasting our time on these stupid tests. So
instead of teaching subjects.
Correct. So instead, if I teach that, you know, so it is. So again, I gave the example, No Child Left Behind, new standardized tests at various grade levels. Now President Obama's Race to the Top program links the state funding with educational reform. And this program rewards states that create standards for all students despite possible differences in intellectual talent and ability. So now, as I forgot your first name.
Mia.
Mia, yeah. As Mia said, you know, college stress, that is too much. They apply to so many colleges and to get one spot. And guess what? Whether you have the, even if you have perfect score, you have proved to the world that you can touch the sky. There is no guarantee that you will get into these top Ivy League schools, you know, because they can only take certain kids and they just pick and choose And then, so that develops stress for kids. They think that, oh my God, I worked so hard, maybe I'm not smart enough, you know. So the stress from application process, and even highly qualified are rejected due to limited space. And so there is a new documentary, it's called Race to Nowhere. It was created by a mother after witnessing her own daughter develop a stress-related condition. So while the US and UK are requiring more hours in school with schoolwork at home, many of the top-ranking East Asian nations are limiting students' time at school to ease the levels of stress. So Finland is #1 educational system in the world. So look at some of the facts. Finland allows 15 minutes of unstructured time for play. So the kids, they just instruct for 45 minutes, 15 minutes free play time for the kids. No school before 7 years. Here, at the age of 2, you go put the child in the preschool so that they will develop some skills. No homework for younger children, no exams for students under 13. All classes have students of mixed ability, never more than 16 students in science classes. Tons of breaks every day. Teachers must have master's level degrees. Teacher training is paid for by the government. So there is I don't know how many of you had a chance to learn about Tiger Mom. So Tiger Mom is a Chinese mother. So she has published many books, you know, about, she is a total opposite of what I said, you know, so she's a pushy mother. So she has 2 daughters and she pushed both of them, but only one was able to take that, and, you know, she moved on, but the younger daughter was kind of a rebel, you know, so she said, no, I will not do, why are you making me do piano? I hate piano, you know. So that's, so the Tiger Mom, so which is a pushy mother. So if you get chance, you know, I would, you can just go online and search Tiger Mom. So here I have some little video clips for you guys to see. The first one is racetonowhere.com. It's really hard.
Just take off your clothes.
Daryl's saying that a lot today.
I'll put the phone on.
Everybody take off your clothes. We're doing naked sessions today.
Let's talk about this.
You being natural, yeah.
We have to turn off what?
The projector.
Let's see what the other few things.
Pressure that every day.
Can't make a full screen.
I'm afraid that our children are going to sue us for stealing their childhoods.
I would spend 6 hours a night on my homework.
You have to get into the top school.
You have to take tests and do interviews.
It's gone way to the extreme.
We're all caught up with it. In America, if you don't earn a lot of money,
something went wrong. The pressure comes from the colleges, from the parents, from the government, but it has to stop.
You have to do well now, so you have to encourage them.
Everyone expects us to be superheroes.
You have a fear from the parents that my kid needs to be able to get a job.
How do you expect it to do well when you can't even make mistakes?
You're dedicating your whole life to your grades.
You have to be smart. You have to be involved in the arts. I have soccer practice every day, plus the homework on top of that.
Produce. It's impossible. I couldn't cope.
I've gone through bouts of depression just because you feel so swamped.
I almost like had an emotional breakdown. There have been 6 suicides in our school district.
Our students are pressured to perform. They're not necessarily pressured to learn deeply and conceptually.
But what is that going to mean when we have a whole population of dentists and doctors who've been trained from the script?
Things that actually get our students to think are pushed aside.
These kids come to the table with this creativity and this love of learning. Let's just not take it out of them.
I think the United States really needs to rethink how we do schooling. The economic future of the country depends on our addressing this.
We need to redefine success for kids. It's got to be something we put together. All of us as a society, almost as a movement.
Jobs need you to be a critical thinker. They need you to be a problem solver.
We need to really think, what does it take to produce a happy, motivated, creative human being?
Next one, okay.
This was interesting. I saw a Washington Post, so they say that the Race to Nowhere documentary is wrong. So you have parents, so I think she is similar to the Tiger Mom. So people have, it's like any other ethical question.
We can have
you
a
know?
discussion after this, because I also watched this. So I have also some opinion on it, which may not be in tune with what research is saying. But I do agree with some of the points.
Yeah.
This is the Washington Post, right?
I know in my experience, before my children were even in school, we were looking at preschools, and in speaking with other parents, that's what parents do, it was instantly, well, my kid's never going to go to school here, they're going to go there because this is where it's good. And I remember getting caught up in all that. And it wasn't until, the public school system wasn't good, they had to be in a private school, whatever the area we were in. Very, very caught up in that whole thing, just in speaking to other parents. It was when my oldest daughter got to 8th grade, and I had 2 younger ones, that she didn't want to be in school there anymore. Other kids were leaving. They were in private school. They were in all the accelerated classes. They were, getting the instruments and the this and the that and all the well-rounding, the whole thing. That she said, I just don't want to be there anymore. And I sent her to the public school. Only to find that she wasn't any more advanced, that she was getting straight A's because she was being spoon-fed by the private school. The private school was keeping the parents happy because they were paying the money. And I was so infuriated because I thought I was doing something more for my children. I pulled them all out. And I put them all in public school. And then they were there, they weren't catered to. They were expected to be responsible. They felt a little bit beat up by that because they were used to everybody doing for them. And I was really glad I did that, and I wished I'd done it sooner, because that's the normal pressures of life, in my opinion. To be responsible, do what you have to do, get involved with something that you're interested in, partake in that. And even kids in sports, You know, in school, they have an injury, and the parents are pushing to get that child back out onto the field to play, and at the expense of their future health in life. Coaches and parents. So there is a lot of pressure coming from different directions, and I think, and I was caught up in it myself. I'm not there anymore. There's a fine line. You know, you don't want to sit back and say whatever, nothing matters. But on the other hand, you can do too much pressure.
Correct. Yeah.
I was just going to say, I think I'm at that stage. And Dr. Mercer said I could be a tiger mom, but I don't think so. But I'm at that stage where my kids are 2 and 4 years old, and my thought process is okay. I do have my daughter in a school, but it was convenient because I work in this community. So she goes to this school where she's learning so much. So I'm like, okay, but she's also a sponge right now. But on my other view of things, I'm looking for a place to buy a home, and I got caught up in looking at the school district and what was going on there, and I'm like, wait, I need to really focus on what communities I'm in, what neighborhoods they're going to be in, what kind of groups are going to be surrounding them, because I think that's probably one of my biggest worries as well, is coming from a community with such high rates of everything. I want to make sure that they aren't, I guess their environment that they're going to play in, the kids they're going to be around, that's going to be a positive environment versus an environment where I'm worried about that. I say that because I'm not looking in Phoenix, where I know the crime rates and everything else are bigger than in Mesa or in Scottsdale and things like that, because I think and I told myself I'm going to see, try out this activity, and see what they enjoy, because I want them to be active. I want them to be involved in things that keep them occupied, where they're not getting in trouble, where they're not, just going with the flow, or because I think sports definitely helps their view of things and helps them socially. As far as being a part of a team, that kind of environment. So, I mean,
you are absolutely right.
So, I don't know.
I am not, this is definitely not every parent should try, because unless the kid try different sports, different activities, we would not know which one he is passionate about.
Yeah.
So in the younger age, but we are not forcing them to be best during that time. We are just making them participate in, correct.
Yeah.
Tasting different things. And then the kid has to say, okay, I hate piano, I want to do only this, and I don't want to be in sports, I want to do this. Then the parent should be happy, okay, I'm glad you picked the 2 out of 10, So those 2 which they are passionate about, they should be involved in. Then you don't need to tell them to practice, they would automatically practice, because it is
they're enjoying it.
They are enjoying. So at a young age, it is important for parents to put them in different activities to see that which one they like. Another thing I want to talk about is in the real world, if you are working in a workplace, you are not going to have perfect individuals around you. You are going to have different types of people around you. People who are working hard, who are not working, who are smart, who are, so you will have, so that kind of experience you will get only in public school. If you put in private school, kind of it is designer babies. Yeah. So all of them are rich, all of them can afford to, everything. And then these kids will think that, oh, this is how real life is. And when they come out in the real life, when they see kids with special needs, kids with this thing, they won't be able to know how to interact with those kinds of kids. They are going to act like some of the gifted and talented students. Oh, you are stupid, you don't, that is where bullying starts.
Yeah.
So it is really good for a child from the childhood to experience, mixing with other diverse populations. That's why I constantly send out emails to my parents, come and volunteer in my classroom. If you have something, come and share with my students. They should come and see what type of students I have in my classroom. My other goal is trying to identify more minority kids. So if I have white population, all 95, 98 percentile, I take 89 percentile African American kids in my class, but nobody else would know, Only I know the principles, and because I want to give those children an opportunity to be with the top kids, because they should think that, wow, I am smart too, I am with these kids. And so that is where, my thing is. So what I am trying to say is, don't try to push your children to 2 or 3 grade levels. You don't need that. And they don't need to be expert in everything. So they can be good in, education, and then even if they get 1 or 2 B's, it's not going to affect their, future. It's okay to get B once in a while, So then the kids should have, choices in taking my mom said, I have a student who loves to read, but he said, guess what, my mom said, I have to do what you are making the other students to do, Then I called the moms. All of my 7th graders are doing We the People project, citizen project. So what they have to do is they are learning in the 7th grade social curriculum citizenship skills, so how to become a citizen, how you can be a good citizen, and what are the laws and stuff. So I make my 7th grade gifted and talented students. I have almost top 10% in each grade, 30 kids in every class. So these kids will identify a problem in the school or in our community and try to take action to solve. That's a project-based curriculum for 3 months. So we divided they divided into 15 of 2 groups. One group is telling that we hate the school lunch, so they, in the name of healthy product, they have only salad, no other thing, the rest of the food are not at all tasty, and we need good food. So we want to, either they have to fire this Daher, and so they are working. Another group is working on, we offer only 2nd language from 6th grade, so when we did research, we found out the kids who are learning 2nd language from 1st grade, they are doing better than us, so 2 groups are doing research project. This kid said he's the only one who was not working. So when I called him, what is your thing? Why are you not working? He said, I don't like both the topics. Then I said, okay, if you have your own topic, you are welcome to, because my goal is not for you guys to win and go to the state level competition, As long as you are passionate about one problem, do that project and I would help you. And you know what he said? No, my mom said, I have to do what you have assigned to other 2 groups, so I should be with the group. I cannot do independently. I called the mom and she said, okay, in front of me, I think she is pressurizing the kid to do what the teacher is, So those are all the things I want to bring it out, do not pressurize the kids. They should enjoy what they are doing. So that is my point.
I agree with that. I have my younger sister, she skipped a grade growing up, and just made her grow up way too fast. She ended up getting a boyfriend at a young age and then being engaged at like 18, and I was like, no, what are you doing? You're going up too fast. I was like, do not do that. And freaking me out. And I mean, and even in my own life, I mean, my parents were all about, do good. They actually pushed me, and then my coaches, all my basketball coaches were like, you're not scoring more than 20 points, you need to be putting out more baskets than that. And like just pushing all around me, and actually till I got to the point where I actually literally had a nervous breakdown in high school, and I had to go see a psychiatrist because they're telling me that I had unrealistic goals and things that I kind of already knew, but the messages that people keep telling me, but it was not what they were telling me. Like, oh no, you have to be perfect. I remember I came home one day with an A- on my AP biology card, and they were like, oh, an A-, what is this? You're slipping.
Wasn't good enough.
Yeah, it's not good enough. And I just remember I was kind of freaking out a little bit. So it was, and to recover after that, like, I still feel like I'm not the same. It was, I don't know, it like broke my brain or something, because learning was not been as easy as it was when prior to that happening. So I totally agree that push them so that they like it and they enjoy it, but not to the point where they're gonna break and that it'll be detrimental to them in the future. Because even my younger sister now, after that, she just, oh man, she even got the Bill Gates scholarship, and she had everything paid for. She could have gone PhD all the way up through to get it paid for, but she just pushed and pushed too fast and too far, and she ended up just losing her scholarship, all that money down the toilet.
If they are passionate, they will do anything. So I was sharing, Daryl knows, and I have two daughters, the older one who got into medical school. My husband was just teaching her how to play chess, and he took her to a chess tournament, and she was the only girl there. So the boy who was her opponent said that, oh, I'm only playing a girl, I will be out in 5 minutes. He did beat her in 5 minutes, but my daughter said he does not have the right to tell me that just because I'm a girl he could beat me, to get me a chess coach. And we got a chess coach. In 2 years she became the state champion. So she wanted to prove to the world that it is girls can also play chess. She applied for grant. She got $5,000 grant. She conducted for 100 inner city Milwaukee girls 3-day free chess camp. She gave free chess boards, chess sets, everything. She taught them chess, and that was only the first tournament, first thing. Now she's conducting her 5th all-girls free chess camp in Pittsburgh, because she is in University of Pittsburgh. If the child is passionate, they will go any far without any this thing. Similarly, my younger daughter, I have a niece who was bullied in school, so she is coming and living with me, you know, so from Chicago. She is now living in Milwaukee to go to school with my other daughter. And my younger daughter, there are at least 4 suicides in our community because of bullying. So she wanted to do something about bullying, and then she was looking everywhere, you know, bullying, anti-bullying, peace camp and everything. So we came up with the YPA 9 Youth Peace Ambassador. Then she applied, she sent an email to Daryl, hey, I am planning to conduct a peace camp, and he said, oh, you are welcome to attend. So she thought maybe by coming and presenting here, somebody would give her grant to conduct, you know. So, but after the YPA training, she went back, she applied for a grant. She said, you know, I have this cool idea. In fact, I was invited by the International Youth Peace Conference to present my idea. So I presented at the YPA 9 to more than 40 youth from across the world. And everyone thought this is a great project. I also got good suggestions from other people. So help me to conduct. And she received $1,000 from Youth Service of America, $1,000 from Kids Brave Life, and she conducted for 110 students in Milwaukee on December 6th. So let me show you the this is the TV, and there's so many articles, so many TVs came, and so now she's getting more grants to conduct at different schools. So all the schools have approached her that would you please able to can do something in our school too, you know. This is Ananya who came to YPA 9, so some of you. This is kind of for Girl Scout Gold Award and Peace Camp.
Welcome to Crochet, where we ride with you every mile. When we say we ride with you every mile, it means we really care about you and care about how you're treated.
Because at Crochet, we ride with you every mile.
Every mile.
We ride with you every mile.
Family was harassed because of their culture. Now, a Silverwood High School student made a permission to stop.
Volume louder, please.
As told us Tony Valley reports, new at 10, she's organized an anti-bullying camp with most
Beautiful song.
So the title is called Step Up Against Bullying and Violence. 16-year-old Nydja Murali is determined to stop bullying.
Show them that you're not afraid to be who you are.
It's a lesson she learned as a young girl when her family left India and moved to Montana months before the 9/11 terror attacks.
They started harassing us and smashing our car windshield and tires, and just saying, go back to your country, we don't want you here.
Since that time, it's been her mission
to
promote
remember your community hall.
working to earn her Girl Scouts Gold Award
She's now preparing to host her own anti-bullying camp for girls at Glen Hills Middle School.
It's basically going to be like a leadership camp where the girls will learn skills to empower themselves.
Many of the activities will take place here in the commons area of Glen Hills. These seats will be filled with more than 100 girls in 4th through 8th grade wanting to learn how to combat bullying. Glen Hills Principal Dr. I.D. Smith says middle school girls seem to be the most susceptible to bullying, and this opportunity could have a big impact on their lives.
Giving them the social support, giving them strength, not just we're able to stop bullying at the level where it's most predominant, then it won't continue further on.
In Shorewood, Tony Valier, WISN 12 News.
Murali is able to host the anti-bullying camp this Saturday after receiving 2 $1,000 grants.
So if the child is passionate, you don't need to do anything, everything, she did it. So of course I supported her, I took her to Sam's Club, Costco to get snacks and, ordered pizza and stuff like that. So you don't need to push your child to do that, I did bring her to IPA 9 because I wasn't sure, whether I should send my daughter alone. So I did come with her. She was 15-year-old, last year. But apart from that, I never pushed my children. They were never accelerated, So 2 or 3 years, you don't need to push them. So that is what I'm trying to tell parents, that don't push your child. Let them have their own interests, So if they are passionate about even one thing, that is good.
So as a parent, as long as you're passionate to show them different things that are available.
Correct. So like your niece, she is passionate about Native American culture.
Absolutely.
She went all the way to DC to fight for her. That one thing is enough for her to get into top schools. That is what they are looking for. Of course, she has to be a good student as well. But she doesn't need to skip 2-3 grade levels and get straight A's and everything,
If she wants to skip 2 or 3 grade levels, she will.
Correct.
You don't have to make her do it.
Correct. You don't need to push. This model is not for every child. Every child is unique in his or her own way. If a child is really bored, and the teacher will automatically notice that, and then the teacher will give the child different placement. But the parent don't decide that. Since parents are paying money for the public school, they come and demand. They come and bully, Every morning I get at least so many emails, kind of bullying emails, Why? And they want their children to get all straight A's, and this is I don't know where this race is going.
Nowhere when they come out of that kind of environment. That's why I pulled my kids out. I saved a bundle of money too, but it was really
basic argument is that parents pressuring the children is the primary reason for them to be aggressive.
Correct. And depression also.
But they're not only pressuring the kids, they're pressuring the teachers.
That's why I'm going to, there are 2 documentaries on that. I want to watch that. I'm going to order those and
you might be
watch.
right, but how did you prove that, to show that that's the case?
So I'm going to just ask questions. This is, I'm still in the preliminary stage.
I'm just pushing you, okay? I'm not saying
No.
as a teacher.
Okay. So I started writing my survey questions. So basically what I'm thinking is, I'm in the very, very beginning stage. So.
That's great. It's good.
So I want to ask the students that, do you feel pressurized to get straight A's, from 3rd grade, so they don't need to worry about grades at the time, First, I want to ask, are you a male or female? How old are you? Do you feel that you don't get enough free playtime during the school or after school? If so, why? How much time do you spend on your homework every day? How about weekends? How does your typical weekend looks like? Are you involved in extracurricular activities? If so, how many? How much time do you spend on extracurricular activities? Do you watch TV? If so, how many hours? Are you worried about college admission? Do you feel pressurized in school with school assignments and tests? Have you ever felt that you need to work hard and join the race with other students in order to be successful in school? How much time do you spend on internet or video games? Sometimes, I want to just ask whether, do you feel worried or depressed.
So this is clearly IRB material.
Okay.
So the first, I want to ask you if you don't mind. So what is your thesis? What is your one statement?
Are we pressurizing our younger generation too much?
You can open the proposal.
Oh, that's the proposal.
You open the proposal.
Are we expecting too much from our younger generation?
Where is it?
Thesis title.
And what's your antithesis?
Objectives, go down.
I want to research about the student lives of the younger generation because youth depression rates are increasing.
So, you know, I think it's a fascinating topic. I think it has massive publication appeal, but you got to be real careful with your questions.
That's what I need help
Yeah,
with.
no, everybody does. Everybody needs guidance, you know, but I think you're right on point with some very exciting stuff. Are we expecting too much from our younger generation?
Who's we?
But who's we? You're asking the children, do they feel like they're expecting too much? I mean, you follow?
Yeah. So you know,
are you going to ask the parents if they're expecting too much, or are you asking the children what they feel? Because if you ask the children what they feel, you may not be clear on what the expectations are.
I want to do interviews with children, two groups, fourth grade and high school, and parents. Interviews with teachers and guidance counselors.
So the children and the parents. And what will the interviews of the teachers and the guidance counselors?
Okay, what do you notice in general? Because I am going to focus only on the gifted students, the top 10% in each grade. So it would not be applicable to any students who is not performing at level or below level, you know, so they don't care. You know, some of the, as I said, 45% of my student population is from poverty level. You know, even if they ask them, do you feel pressurized? You know, even in everyday class, I see other teachers struggling. I'm not interested, you know, I'm not going to work on your math. You know, they are not going to answer me. But what I'm doing interviews with only children in the top 10% of each grade. So are they feeling pressurized?
If they feel pressurized.
To get all straight A's, you know, or to be in the gifted. So these parents, they want to make sure that kids should be in the gifted program of the school. To tell others that, hey, my child is in the gifted program, you know. So only that population alone, I serve 140 students. I'm going to send out surveys. At least I'm hoping I would get back 100 surveys back, you know.
My thoughts are just, I think at that age, for the youth that you're going to survey, I mean, I don't know about everybody, but I work with you, so the common response is, I don't know.
Not my kids.
Yeah.
Not my kids.
What do you think about the UCLA study that was quoted in the Washington Post and the University of Minnesota, I think it was? Michigan, University of Michigan.
Yeah.
What do you think about those studies?
I don't know, because I want to explore further.
But you're exploring further at a very select group.
How can I open it? Can I open it up to every student?
I would. I mean, I don't want to tell you how to do it, and you could do 5 different research projects on your topic and get them all published. But certainly you want to look at the top group.
Yeah, first.
I would look at the group that's not in the top 10%.
Okay.
And see what are they experiencing?
Okay.
How do they feel that they're not in what you call the top group?
Then can I just exclude high school and just do 2 groups?
You can do it any way you want. I mean,
okay.
your research topic has 10 articles that you could publish from it.
Correct.
So if you gather your data carefully, you can publish 10 articles, just one right after another. So think about it some more. Find different groups, and don't publish everything in one article. Take different, but think this through, because you're sitting as a teacher in a position to have access to this information. It's pretty cool stuff. I went to school in Milwaukee. You know, I was on the south side of Milwaukee. Nobody was pressured. You succeeded. You succeeded if you were hungry.
Correct. You're in that different
If you weren't
generation.
hungry, you didn't succeed.
It was a different generation.
That's generation.
Just like we should.
That's our generation.
Yeah, that's right. It's like the generation. You know what you should do? And you know that one, you'll have the slide where it says the Millennium Generation.
I'm going to use that. Yes, that's
Slip
what I
that in
said.
there. Yeah,
Correct.
yeah.
I'm going to
You're
use
right.
that.
You're right.
You're not from that generation.
My generation is different.
You would have answered all those questions
Let me tell you
completely
something.
differently. Than
Nobody on the south side of Milwaukee took piano lessons. Right?
We
Nobody.
did in Indiana.
Nobody.
Yeah.
You know, I mean, I didn't know what a swimming pool and a private house was till I was 30.
Even among my two daughters, you know, so the older one who got in, you know, she just did just because her younger sister, my younger sister was musically talented. She composed a school song and she put music, you know, she wants to even major in Ananya. She wants to major, apart from, she also wants to become a doctor. So apart from that, she wants to minor in music, you know, so she wants to get into a school where they have music and medical program. So my older one, she can play, and she went to even Carnegie Hall for performance, and she's also a really good musician, but she doesn't want to pursue. And I said, oh, you left your violin, do you want to get, no, I am done with the violin. I want to enjoy my college life. She left the violin at home.
You know what would be interesting is to take those categories of parents and then come up with a name of what their children should be. Categories of names of their children. You know?
Yeah.
That would be
I think
cool.
looking into the parents
You'd
would be
publish that.
really interesting.
I could publish 20 articles from this.
You know, and then coincide it to what the children
Yeah,
feel.
yeah.
It's hard to. I think it's hard to get the answers as to what the pressures are from the environmental of the school itself. I think that's a difficult one. I don't know.
Yeah, as I said, I have a diverse population. We have Native American students. We have from NPS, you know, from the 220 program, those children come, homeless children, and we have, and at least 45% of the student population is taking free and reduced lunch. Other 55% is top affluent, you know, the person who's running for mayor, his children, and so he demands. He would come and tell me that my daughter from tomorrow, she's going to 5th grade math. There's no testing, nothing. He will come and demand the superintendent. So I said, oh, how come Annalise didn't come to she's taking 5th grade math. I said, how can she take 5th grade math? I didn't test her. You don't need to test because he's a school board president and he is the mayor, so his daughter will automatically go. So my superintendent said, you can, I went and fought with my superintendent. He said, Ms. Murali, you just stay away from me. I get so angry when the parents do like that.
You're going to have to address those articles.
Yeah.
The Michigan and UCLA.
Can you go back to your questions, please? Now, by the way, I have brought a few research pieces, which are useful for people to look at thesis. This one actually is actually a master's thesis of Marcela, who's a Mexican professor. She then did her doctorate, but she worked a lot. She's a school teacher, and she did actually apply the bioethics education materials I developed. She translated into Spanish, and then used it to study how to lower the dropout and suicide rate in Mexican young people in high school as a doctoral thesis. And now she's specialized in bioethics, but that's 10 years ago. But this is her master's thesis in Spanish.
Oh.
I have a few doctoral theses in English, but for example, these sort of questions you can see. If I was doing this
This is for fourth graders. They
For
should
fourth grade,
understand.
what I would do, for example, your questions about how they use their time, I would just ask them and probably interview, how do you spend your time? And what things do you do? Not to be leading. Yeah? And then you can repeat. And instead of the written questionnaire, I would interview them. Even though it's going to take more time, you'll get the right response. And you can encourage them and you can see, what they're like. And what do you spend your time?
I would tape the interview too.
Okay.
And open questions, you'll get so much more out of them. And it's more reliable.
That's true.
Because you see, if I said, or do I watch TV? But see, normally I'm not thinking about TV.
Yeah, audio tape.
Not videotape, because you'd have their
freak out.
identity.
Yeah. But after, of course, they do a few open questions, you push them, you can ask the data that you really want to measure. Like, I do want to measure how much time they spend outside, how much time they spend playing the piano, how much time they, watching TV, how much time I spend playing with my brothers and sisters, or how much,
Whatever it is.
But you want to ask about the pressure from the parents, and then here at the moment you haven't got pressure questions.
Yeah.
Yeah. But you're just working on this now, so it's sort of a
how much
work in
time do you
progress.
spend? How do you spend your time? And do you wish? Are you doing any of those activities because your parents wanted you to do, or is there something you want to do? That
You can ask, what does your parent want you to be in the future? And then they say, well, they never told me. Then it's okay. But if they just say, well, they want me to be a professor, they're pressuring them.
I think the order you ask the questions in is going to be important
Yeah.
too. Because if you ask them about their parents first,
Yeah.
then they've already put it out there. You need to ask them about themselves first, then you can ask them about their
Right.
That's what I will do then.
And then also you've got another thing here. I was thinking, you've got academic pressure, but you've also got disciplinary pressure.
Yeah, there's different forms of pressure.
You want your kids to behave in a certain way. You want to punish them if they don't behave according to what you think. But you have different education styles that let kids run around like crazy because they think it's better, but they learn themselves. And other educational models which say you should guide them or even use strict punishment. So
that brings on a whole slew of questions.
Yeah.
What happens if you don't get a good grade? What is a good grade? What happens if you get in trouble in school? What happens,
Yeah.
And there's all that parenting that comes into all that.
So the question is how, and then let's say you come to ethics committee and say, well, I'm going to have an open questionnaire with, these are 9-year-olds, let's say. I'm going to have a 2-hour interview with them. We're probably going to say, no, it's too long for a 9-year-old. But how much time, and so you might want to spend, as a teacher, how long they're able to talk. Then you have an institutional question if you're going to do the interviews at home or at the school property. Now, you said the school will probably agree to you because it could be part of the, and they have, because it's part of the, in a sense, it's an extension of your work. It's sort of research related to the better performance of your job.
What I'm going to tell the parents also, I have my own gifted and talented curriculum. So I have put together projects like this and everything. What I'm going to say is, I'm doing my master's program. I really want to know what the kids are actually interested in. These are all the gifted curriculum that's out there I'm putting in. So if I hear I want to interview kids, how they feel like, because for example, if they think that they are not getting enough free playtime, maybe out of 5 days, every Friday I might have tons of games in my class and have them come and play free time, So that is my goal. Number 2, if I'm making them do writing competition, oratory competition, essay competition and stuff like that, if they are not interested in doing that, so if they want to learn a computer program or something that they are really passionate about, I want to introduce that in my curriculum. So I want to interview students to see what they like, how much time, so that the parents will say, yes, go ahead. And,
yeah, but I think you have to be very careful that, if you start asking those questions or start talking to the school principal and this and that you want to do research, they may freak out a little bit. You should have some IRB behind you first. Okay. Because remember, even if you say you want to ask these questions to improve what you're going to do in the class, even though you think that that's not research, that activity is research. And that falls under an IRB, and they'll know that. The school will know that. So just be careful.
Into how you're going to use
well, see, her school already agreed.
Yeah. But it's a great area.
Is there an expression, tiger teacher?
I know.
The other thing the parents like me is because they saw how my daughters are successful. My older one is a valedictorian. Everyone knows, Murali sisters means. So the parents know that I am a parent also.
Right.
My children are successful, so they have high regards for me. What I'm doing is good for their children. So, but I do have some parents who are bullies, who just come and demand. They will go behind me. I would tell them that you don't need to push your child. Let me give an example of my daughter. She got in. Your child is really bright. He will. No. They will go behind me, talk to the superintendent. The next day, the child will be in the next grade level.
Yeah, I know those parents.
So I want to just show it to them that this is what.